Slide 1 of my presentation is the title slide, and it states Racism and its Effect upon African American Mental Health, an end-of-term contemporary psychology project by Alisha and Gray. Okay, slide 2 of this presentation is an introduction, and it discusses what the effects of racism are directly upon African American physiological and psychological responses. And the photograph here boldly states, "Racism makes me sick. It damages my heart, blood pressure, and my unborn baby." Underneath it gives information about what researchers have found, which is basically that there is a problem with premature infants related to the hyperactivation of the neuroendocrine system related to pregnancy. And the second is an immune inflammatory pathway. So maternal stress increases both, and the exposure to stress to chronic racism specifically has been listed as a very possible and plausible risk factor in African American women. That is significant, and that's something that right now not a lot of people are talking about, that they really need to be talking about regarding African Americans and what is affecting our physical health. And that is crucial as far as pointing that out. Now, also on this topic of exploring the effects of racism on African American mental health, we see that there's a significant problematic area excuse me, within modern psychology, as it's kind of ignored as a plausible inference of what is causing both physical and psychological issues for African Americans specifically. However, study implications have proven this. Once again, there's another study which shows that perceived racism may impact Black Americans' mental health, and that the psychological responses to racism are very similar to common responses to trauma. So basically, the psychological distress is re-input into the African American individual as physical pain, sensitivity, anxiety. So we're seeing these race-related stressors on African American cultures, which are causing other significant problems that we're going to have to deal with in the future. So I think that this is, again, a significant area of study that we need to we need to pay closer attention to. Slide 3 of my presentation is also part 2 of my introduction. It's entitled Racism and Mental Illness, Why Psychologists Study It. And within the slide, there's a photograph of a young woman who is an African American mother. The sign that she is holding up reads, "I am the mother of a young black male who was stopped on several occasions by the police with guns drawn. Justice for Trayvon Martin." This, of course, refers to the death or murder of Trayvon Martin, a young African-American youth, on last year. Mental health in African Americans have been severely and significantly affected by racism and oppression. There are several factors for this. Several are listed upon the slide, along with the correlating citations. Examples are poverty levels, which are 3 times more likely to cause psychological distress. African Americans are 20% more likely to report having serious psychological distress than non-Hispanic whites. Also, non-Hispanic whites are more than twice as likely to receive antidepressant prescription treatments as are non-Hispanic blacks. The death rate from suicide of African American men was almost 5 times that for African American women in 2009. The suicide rate for African American people is beneath that of Caucasians. However, there's a significant amount of underreporting within the African American community of mental illness. Part 4 of my presentation is also part 3 of the introduction, and it's a continuation of why psychologists study oppression and mental health in African American communities. Another reason that African Americans have such a significantly different viewpoint in reference to mental health care is they have limited access to mental and behavioral health care. There's a greater need for culturally competent psychologists, as most psychology was created by white males, and it's often inefficient when handling issues of race and oppression. Poverty and social structures are also significant barriers in actually attaining the proper amount of mental health awareness for African American people. Things that can be of significant bother within African American communities as well affect mental health are racial profiling, hate crimes, self-esteem issues implied or caused by racism, stereotypes, and long-term impacts of oppression. Many people believe that there are stereotype threats which become self-fulfilling prophecies within African American communities, which actually create a cycle of oppression which we now recognize in the fields of sociology and social psychology. Slide 5 within my presentation explores the different research methodologies used by psychologists in their research. It contains a video of a previous PowerPoint presentation, which includes also the citation and link to that particular site, which gives a detailed presentation of both qualitative and quantitative methodologies in research, as well as other detailed information. In reference to my field, psychology of culture or cultural psychology, it normally uses the qualitative methodology. This is distinguished from cultural psychology, as a side note, in that it uses a positivistic methodology. Part 10 of my presentation is a critical comparison of psychological perspectives. Within this portion of the presentation and on this slide, the three different perspectives of psychology are listed that I chose to study for this presentation. And they are the psychoanalytical approach, which is characterized, of course, by Sigmund Freud, the humanistic perspective, which was characterized by Maslow's hierarchy of needs, and the biological perspective, which has been controversial. And in this particular discussion, it was vital to mention its connection to Darwinian forms of biological racism. So also within this particular slide, there's a flowchart which shows all of the different perspectives of psychology as they pertain to one another. Slide number 11 is a depiction of psychoanalysis and Freudian thought It's one of the reasons why psychoanalysis has conflict within African American cultures. This depicts Freud's quote unquote Negro joke. And this joke was by Freud labeled an old joke, referring to his American patients as quote unquote his Negro. Within this content, which dated back to 1886, there was actually a cartoon which depicted much of the same and showed Freud as a lion yawning, waiting for his 12 o'clock Negro. 12 o'clock and no Negro. So pretty much I think that the depiction by Freud was both of objectification as well as analyses of the black culture. That's a professional way of putting it. It gets a little bit more in depth when we start talking about later on Norman Mailer and the white Negro, which basically was a continuation of Freud, but he also chose to look at some other angles when he did his work, and he's seen as a Freudian Marxist. So he talks a lot about how there's the romantic vision of black cultures, which at the time were Negro, which in turn scared white cultures, but then he objectifies and romanticizes so much about these other cultures that it almost seems absurd. So he's also quite controversial, much the same as Freud. And Freud, for this particular content of the Negro joke, has been criticized for exhibiting the same psychosexual anxiety that he actually diagnoses in many of his patients in relation to the black culture. So that's significant in why there is conflict with psychoanalyses in dealing with African American culture specifically, and later on we will discuss Franz Fanon, which goes a little bit further into an analytic view of why there's controversy there. Slide 12 of this presentation is again a continuation of Freud and the Negro, the conversation. This one is a black feminist perspective, and it was taken from a book which was the winner of the 2005 Gradiva Award for the best book in historical, cultural, and literary analysis for the National Association for the Advancement of Psychoanalysis. And within this book, the author Tate suggests racial meaning is inscribed in psychoanalytic discourse. Her analysis of Freud's Negro joke, the manifest text of psychoanalytic discourse, employs racial language in a way that deflects attention and understanding away from rather than toward the racial meaning and anxiety that underlies it. So Freud's recognition of himself as the lion rather than the Negro confirms the analysis and his own personal position of power within psychoanalysis. So, as Tate puts it, Freud's 1924 version of the Negro joke relies on a symbolic transaction that revises the power dynamics between himself, his patient, and the discourses of anti-Semitism on the one hand and white-black racism on the other. Now this goes in a little further, and there's an excerpt from the book which I placed on this slide as well, which you can read along with the noted citation of where to find the book. But the reason why it was put there is it shows just another angle as to how psychoanalysis directly conflicts both African American culture and black feminism because of the containment where Freud analytically did not analyze, I guess analyze is the word, but he did not actually police himself, whether that was purposely done or not, in reference to his thoughts on African American culture. So later we're going to talk a little bit about how people used psychoanalysis that Freud helped to create in order to critique his own work. Slide 13 is entitled Psychoanalysis, Persons of African Descent and Racism's Effects. And it details the works of Franz Fanon, who is infamous and world-renowned for his black skin, white mask. The picture shown within the slide says, "Oh, my body, make me always a man who questions black skin, white mask." So, first of all, we give a quote on this page from Franz Fanon, which details how he feels about the racial discourse between black and white. And also, within the article that's quoted, it gives how Fanon used the psychopathology normally attached to Freud in order to both critique him, yes, as well as give him a little bit of praise for his work. But let it be known that post-colonial and neo-colonial works that were critiqued by Fanon were done in relation to a retaliation of sorts against the Freudian point of view. The next slide is in relation to the second perspective of humanism, and it's entitled Humanism Perspective, African American Psychology and the Effects of Racism. And our shows a book written by Adelbert H. Jenkins entitled Psychology in African Americans, a Humanistic Approach. And it gives a quote from Jenkins. In most of my writing, I have attempted to apply these notions to an analysis of the psychology of the black experience in America. In my book, Psychology in African Americans, a Humanistic Approach, I present the thesis that blacks have survived their oppressive history in the United States by actively and intentionally bringing to their lives conceptions of their competence that have been a dialect variance to the judgments made of them by the majority society. I maintain that the same psychological process applies to other non-white minorities in America. In other writings, I discuss how a systematic teleologic point of view can elucidate some of the basic underlying assumptions of psychodynamic psychology more generally. So what this means in layman's terms is he believed that the humanistic perspective is one of the more favored approaches to psychology for African Americans. Now, this has been both praised and debated in the African American community as we get into a little bit more of the specifics for group intra and interpersonal relations that will make more sense. But for this discussion, it shows that at least there's support for the humanistic perspective above all else by African American psychologists. Slide 15 is additional information that I chose to input, also related to the humanistic formation of psychology. It is the African American or black women's perspective on mental health and racism. And pictured here is a photograph of Phyllis Hyman, who was an African American singer during the 90s who unfortunately took her own life because of a problem which persisted with mental illness. And normally the most effective approach when dealing with African American women, at least thus far, has been the humanistic perspective. So it lists some details here about Phyllis Hyman and also black women and their likelihood of developing mental illness. Also in reference to this, I'd like to personally state that throughout this PowerPoint presentation, you've heard my autistic son, adopted son here in the background. It makes it especially important for women to have that type of compassion when they're getting psychological counseling. At least that's my personal belief, and that's one of the reasons why people have been so supportive of this particular type of formation of psychology, even if it does have its flaws within the African American community, because African American women are so dynamic, and if I can be biased, but it's true, that we really do need to have a greater understanding towards our lifestyle. And slide 17 is the last of the perspectives. That is the biological perspective. And the biological perspective, in reference to African American psychology in particular, is and has been quite controversial. Although it has become a little better as far as its understanding of African American cultures, the beginnings, of course, were not as glamorous in relation to the Darwinian notions of inferiority, which was, of course, attributed to African American cultures. And that is one of the looming problems within the biological perspectives. It keeps leaning upon what one would call scientific racism, even if it is the slightest bit of scientific racism. Most of the time in African American communities, it is a combination of behavioral, biological, and other factors, which cause, of course, the culmination of the problems. You know, racism is not a formation of a biological perspective, although the stimuli and reaction formation sometimes that happen within African American communities is formation of an initial biological reaction. But again, I stress that's more behavioral than it could ever be biological, although there is some significance here. I don't think that it's going to be one of the looming amounts of researchers. It is more disturbing in reference to patterns of aggression and being misappropriated within the biological field versus maybe the behavioral context where it really should lie. So I put a picture here of both, where the initial exploitation of the biological concept was employed to imply that African Americans were genetically inferior. And then we see a child underneath who has a pistol showing aggression against white racism, which of course was initially misapplied as a formation of biological circumstance instead of a combination of behavioral as well as other factors. Okay, slide 18 is the summary of all of these ideas and a culmination of what I've been discussing. Basically, it summarizes quickly some of the things that happen because of the effects of racism: depression, anger, PTSD, mental illness, and it talks about how perceived racism creates a pattern of automatic reaction, which I was talking about before with the stimuli and reaction that occurs. So I think that the studies I've input here give a significant amount of input as to what is happening in the African American community. I have a link to an article here which says study links daily racial hassles and stress spill over to psychological distress, which was recently written. And there's a picture of a gentleman here who's a bit stressed out. And also there's another article right underneath which gives a quote: African Americans who reported in a survey that they experienced more instances of racial discrimination had significantly higher odds of suffering generalized anxiety disorder, or GAD, sometime during their lives, according to Jose Soto, PhD. And it gives a definition of generalized anxiety disorder and what it is. So I think a number of these things have not been discussed properly within normative psychology, and they really need to be explored just a little bit further. Okay, slide 19 is the conclusion slide, and again, it gives a little bit more depth into putting things together, and it connects racial group identification and its relation to individualism, interdependence, and race-related stress in African Americans. So what that means is it goes a little bit further into the identity formation of African Americans and how we perceive ourselves and how we perceive racial identity. And that dependence upon that racial identity is somehow affected by the patterns of racism. So, for instance, if we don't have, which has been considered positive in the past, a positive racial identity, then that could deeply hurt a particular race if they are considered to be a culture without a history or a past, which is, of course, another one of Frantz Fanon's ideals. It's been a number of African scholars have discussed Achebe. Well, I won't go into it, but basically, it's something where cultural identity and group identity are connected. And if that is not the situation in psychology, when we're addressing racialized concerns and how psychological racism evolves, then that creates another whole dynamic. So it gives a link here to a study which was done to basically hypothesize about individualism and group identity. And I did find a site here where I got this photograph from, which was very good, about an African American woman who had studied about lack of ego, which is connected to both Freud and to Buddhism and a number of different things. And she was saying that group identity for African American cultures conflicted with lack of ego. So she was trying to determine, the identification with individualism, interdependence, and so forth and so on. And that was where I got the picture of the young boy here who was, I guess, following behind a soccer player here. What's his name? David Beckham, right? With other children who are wearing painted faces to indicate they are sort of all interdependent, but on what? So I thought that was really interesting. But yeah. Next slide here. Okay, this is the final slide. This is a summary of the findings in a review, and basically it just gives a nice sunny ending to a very tough discussion. There's a book here which was written by a woman who is a professor who studies, of course, African American psychology, and she wrote a book because she felt as if it was not something where psychology significantly gave enough attention to the things that African American people needed to have included in their studies. So basically it says African American psychology consolidates earlier writings and adds new research. Belgrave and Allison first determined which core subjects were to be contained in the textbook. They ultimately decided to include an introduction to African American psychology, as well as sections on physical and mental health issues, relationships, community and neighborhood, Afrocentric values, education, spirituality and religion, and substance abuse. So basically, what that's saying is there's such a great need to input this particular information, not just for African Americans, but for anyone who understands the subject of oppression, just as you do in sociology or social psychology. You have to study the full spectrum. So within this subject of understanding racism and mental illness or oppression that causes mental illness or forms of mental illness within the African American community because of depression, because of anger, because of, a number of different things, then we first have to have scholars that can study it without the white rhetoric of the Eurocentric previous scholars, which ignore the subject of race, which obviously within this whole context, I've ignored the fact that they don't consider race to be a significant factor. I understand the context that race is to be separate in many different psychology disciplines, but I also understand that that is considered to be unacceptable in black and multicultural and cross-cultural psychology subjects for a reason. So basically, it indicates that it warrants closer investigation and analytical thought by scholars. Racism and oppression are major factors affecting the psychological health of African Americans. Okay, and that pretty much ends the discussion here. I hope I have gotten everything in the way that it should be arranged properly, and we've discussed it as much as we can, at least at one interval. It does take quite a bit of time to do PowerPoints, and of course we have the 5-page paper. So it's not something where I could even touch the tip of the iceberg. I was quite surprised that I did find so much information about this, because it is something that is rarely discussed. Normally, again, the discipline of psychology and culture is so tightly wrapped that many people don't want to touch it because of its racist implications in a number of different historical contexts. I mean, we mentioned Freud, but there have been a number, and Darwin, who was actually a social scientist and not a psychologist, but it really has been a negative experience in a number of different areas for persons of color in psychology. So to really go back and look at those and examine them from different perspectives, it creates a whole new dynamic, and hopefully it'll help some people in the future with their studies. So that's the end of my presentation. Thank you. Have a great day. Bye-bye.